Hello again, everyone, and welcome back to week 4 of this class. And in this recording, we're going to look at critically evaluating the medical literature. So the big question is how? How should you go about doing this? Well, from your educational experience, you're starting to understand the components of delivering care as a physician assistant. So you are trained or are being trained in that area. And from that, you have an understanding of who your patient populations are. You have an understanding of pathophysiology and medical treatments. And so if you are presented with a research article, you might naturally look for things in that article and, based upon your knowledge, be able to critique it and express if there are strengths or weaknesses to that article and what those are and how those impact your willingness to implement the findings from that paper. Now, is there a standard approach? And there probably is not a one size fits all approach. We're going to discuss a few different resources, but these resources are ultimately just a guide for you to start your thinking process when you critically review something, when you critically go through the article to see, does the information contained in this article, will it impact my patients now or in the future? So we talked previously about the PICO or the PICOT. This particular figure here includes that time component. Probably the vast majority of the time, people just talk about PICOs. So let's look at some examples here. Let's say your PICO is you are working with an older adult female population and you're looking at patients who are 65 plus years of age or older, females, biologic females with osteoporosis. And you're curious about what evidence is available to illustrate the benefits of weight bearing exercise in changing bone mineral density. And you've decided to make the C group, your comparison or your control, a true control with no intervention. And you dive into the literature, and the first study you find is inactive 20-something females with no history of female athlete triad. The I think we'll see in a moment here, is weight-bearing exercise. Again, no intervention for the C. And O, the changes in bone mineral density. So as you look at these two, they look pretty close, right? They look quite similar, but they aren't. There's a big difference between inactive 20-something females and those 65 and older. Now, could weight-bearing exercise be beneficial for the older female adult? Possibly, but you've only found one article so far in your search, and it was in 20-year-olds. Now, if you start finding articles or you keep searching for articles, you want to understand the context of how weight-bearing exercise could be beneficial. And this gets into how you think about things when it comes to whether or not you were to do a systematic review or a scoping review. Now, a systematic review probably would rely, we should not say probably, we should say it should rely on randomized controlled trials that would take into account a variety of different things. By randomizing people, we would have equal number of subjects, potentially with beneficial medications for their osteoporosis, randomized to each group. And nutritional status, hopefully we would have similar groups at baseline, as well as other things that may be impacting one's bone mineral density. If you weren't finding a lot of different randomized controlled trials, that's where you would want to do a scoping review, but take into account or understand within your scoping review, since you aren't illustrating the results from randomized control trials, that potentially factors like medications and nutrition status or other things may be playing an overall role. Now, the first study looking at the weight-bearing exercise for younger females, it's not that it's a bad study. It just may not apply as something that is of therapeutic utility for your population of interest. So it could be that, as you're formulating your ideas, you may have something of interest and it's not looking at the particular population of interest. That's okay. Has it been looked at with other populations? Is there biologic plausibility? So again, your research question, your PICO, is helping you to not only do your search, but also potentially write your story. It should be guiding the story that you're trying to create. And that story is written based upon the evidence that you find. So if you were working with older adults, maybe, let's just assume before we go on to the next slides, let's assume maybe there isn't enough studies to warrant a scoping review looking at the potential benefits for older adults. Could you find other things that would help to create a narrative, to create a story? And maybe, as you're doing things, maybe you don't do it on 65-year-olds and older, but you focus for the purposes of this class on the populations that are available. Then you can discuss in your discussion section of your dissertation the biologic plausibility and that future studies are warranted to determine the health benefits for the older adult female population. So you ultimately need to draw conclusions based on current research to inform patient care. Now, exercise is a generally low-risk example. So we've been talking about exercise with this osteoporosis example. What about medications, though? Are those low risk? Or how about an expensive supplement with limited or no known efficacy? What are the risks there? Now, another physical therapy related example here. As a physical therapist, I would like to confidently be able to tell someone that my services would help their patients with a primary idiopathic adhesive capsulitis, also known as frozen shoulder, diagnosis. We're going to be looking at this paper in a little bit today. This is an interesting paper. It's very short. It's going to be something that you're going to post upon this week. But as you look at this paper, of course, I, as the physical therapist, would like to confidently inform referral sources like you that my services will benefit their patients, your patients, and be a superior choice financially for the patient. So we need to explore the concepts of internal and external validity and what that means with helping you to understand the quality of the study that you're reading and its potential utility. So internal validity is the degree of confidence that the causal relationship being tested is trustworthy and not influenced by other factors. External validity is the extent to which results from a study can be applied or generalized to other situations, groups, or events. So validity is ultimately influenced by a study's experimental design. Again, internal relates to how well a study is conducted, and external relates to how applicable these findings are in the real world. And you'll notice that one or both of these could be of concern depending upon the paper that you review. Internal validity issues may arise because a randomized controlled trial was not conducted, or there could be other threats to the validity that you recognize based upon your understanding of pathophysiology and clinical care. And then, of course, external validity relates to how applicable the findings are in the real world. So remember the example of the weight-bearing exercise in the 20-something females. This study may have good internal validity, but may not be generalizable to the older adult population. Hence, external threats to validity are in that context. But if you keep searching, hopefully you'll find something. And through that search process, through the things that you did the week prior, you're getting an idea about looking for keyword and keyword combinations. So here are a couple studies looking at weight-bearing exercise for elderly populations or older adult female populations. Looking at internal validity threats. So, like a quasi-experimental design, how does that stack up versus a randomized control trial? There may be very valuable pieces of information that are gleaned from a quasi-experimental design. It may be the starting point, something that shows the need for a randomized control trial, but there are limitations to it. There's a lack of similarity potentially between the comparison and intervention groups, and these can be due to the people, how they were put into each groups, the sites that they were evaluated and treated at, and the time period involved. So without that randomization, you may have unequal groups at baseline. Now, on Canvas are some links, and let me get those pulled up here. Here we go. So in week 4, there's some different links here, and these are for your own resources, for your own ability to kind of explore things outside of the lecture in case you want to. So this one is tips on how to read a research paper, a simple method for evaluating clinical literature, link to critical appraisal tools, and then the Pedro scale. So let's highlight a few of these now here. All right. So how can we critique the literature? Is there a checklist? So this is the simple method for evaluating the clinical literature. And they use the PP icons approach. What's the problem? Who is the patient or the patient population? What's the intervention, comparison, and outcome? Looking like the PICO there. What are the number of subjects and what are the statistics used? So this is just, again, a strategy described by Dr. Flattery. You don't have to use this. It's just a way to kind of organize things in your brain. The critical appraisal tools, this is from the Center for Evidence-Based Medicine. And if you've not been introduced to or explored the Center for Evidence-Based Medicine, this is the group that has been very influential and were leaders in the evidence-based practice movement in the late 90s and early 2000s. So when those started coming out, that kind of occurred after I got out of graduate school, but it was trying to show us a better way of thinking about or organizing literature. And within that website there is critical appraisal worksheets. And so these can then be used to help you to think about the article. So for example, a therapy study, it's not shown on this one here, but therapy study, you've got your PICO information, and then was the assignment of patients to treatments randomized? And it helps you to kind of just check some boxes to, again, collect your thoughts around that article. The Pedro scale is something that's been used within physical therapy, and it provides a score to try to quantify the quality of that article. And when I say quality there, somebody can have a Pedro score article that is a lower score, but still be a really good article, really good research, but it may not rise to the level of scoring an 11 out of 11. Now, do people utilize these Pedro scales and some of these other tools? It's basically a resource for people to go back to help them kind of think about things. What we're going to be doing throughout the term is studying different research study designs and highlighting the strengths and weaknesses of those. That's for the purposes of helping you put things into context as you decide whether you go for a systematic review or a scoping review. But these resources here, these are just things that you can potentially look through. And again, it's just to help you think about, okay, I've read the article. What is it saying about X, Y, or Z? Oh, okay. Let me pause for just a second. All right, coming back to the link to critical appraisals. If you click on that link, it takes you to a different page here, and get that kind of in the screen here. And then if I were to click on randomized controlled trials, then a different document comes up. So if I click on that there, the therapy study that I was looking at or interested in, and you can go through and just kind of check yeses or nos or unclear. Do you have to do this with your studies? No, not at all. This is just a way for you to continue, like I said before, give you opportunities to think about how that study was constructed, and do you feel like it's got good internal and good external validity. Now, it's okay right now if you're not feeling strong about looking at an article and critiquing it. We will get there. And if you have questions each week, that's perfectly fine. Reach out to me or stop by my office. Highlighting here again, this is the hierarchy of evidence. Systematic reviews are at the top. What you want to do when you're doing your searches is it's okay to find systematic reviews, but if there's a systematic review that's really recent, you probably want to try to either take a different angle or find a different topic, because if the science has already been updated, then you're not creating something novel that will help yourself or other professionals. What you ultimately want to do if doing a systematic review is to take papers from randomized controlled trials or take the evidence from randomized controlled trials to help inform that systematic review. And if there's limited numbers of randomized controlled trials, then you're probably going to be doing a scoping review and drawing from evidence from the RCT and below. Now, the Centers for Evidence-Based Medicine have created a table quantifying the level or the hierarchy numerically compared to this table, or not the table, excuse me, this pyramid. So, for example, something in the therapy realm, treatment benefits here. The top is systematic reviews. Next, randomized controlled trials or observational studies with dramatic effects. And then you can read from there going down. This is one example. Why do I share this here? Why is that important? Well, for your assignments in this class, I'm not going to be asking you to define the level of evidence based upon the Center for Evidence-Based Medicine. But understanding the strength of the study design is important. And it helps you with qualitatively writing about, if you had a scope and review, and let's say there were several case series papers that showed an effect. However, if there was one randomized controlled trial that showed no effect, that would be very interesting because obviously with the case series, they're a much lower design on the hierarchy. There's threats within that, threats to validity. How did those studies match up to the randomized control trial? Were they using similar groups? So there's a lot of different topics that could be explored and discussed that way. Now, the Centers for Evidence-Based Medicine also, the scores help you to quickly screen a paper to understand them. So, for example, some studies or some publishers will require a level of evidence to be published in the abstract of the article. And finally, if you plan to publish your paper after graduation, you may be asked to include levels of evidence based upon the requirements of that journal. Here's an example from a paper I co-authored where if you look at line 2, they required, when we were creating those tables to summarize the research, they required us to put the level of evidence. And so both the Fletcher and the Fradkin received a score of 2 because they were randomized controlled trials. Ultimately, critiquing something, it all boils down to your critical thinking skills. And putting into context the article, and sometimes an article can be lower on the hierarchy but be extremely valuable. For example, lung cancer and smoking. We wouldn't do a randomized control trial to observe harm. So a case control study, which is lower on the hierarchy, would be appropriate. A new drug and its impact upon heart function, that would be appropriate. A randomized controlled trial with an appropriate patient population observed for a meaningful period of time would be warranted. Now, what about gray areas? And this is going to be something for this week. This is the article, the Dirks et al., Gentle Thawing of the Frozen Shoulder, a prospective study of supervised neglect versus intensive physical therapy in 77 patients with frozen shoulder followed up for 2 years. So just from reading the article there, it sounds very interesting. 2-year follow-up, that's a very reasonable time period with a frozen shoulder. You see that there's 2 different groups. You see a large patient population, 77. Where does cohort fit? Well, it fits right below randomized control trial. So we're getting an idea that this is not an RCT. So I'm going to be very curious to see your thoughts on this in the discussion area. And what's also really interesting, and I bring this up because again, this ties into how you think about an article and its value, its external validity. If you've explored frozen shoulder, you know that there's different stages, right? And somebody could be in an early stage where things are freezing up. And during that stage, how do you know when that begins? Right? There's no like on or off switch saying, hey, it's been 2 months, now it's this stage. Now it's been 4 months, now it's this stage. There's a lot of overlap in those time periods. So if we don't have good markers for things and we begin treatments at certain time periods with people, what I'm trying to get at, there was a study in a physical therapy journal where they showed improvements in one group versus the other group, and they used a relatively small sample size, but the time periods that people had frozen shoulder for were really large. So if you are in an early stage, will treatment be beneficial? How did people get randomized? Did people get allocated to one group, and maybe those people allocated to that group, they had an earlier onset versus another group? So there's just what I'm just trying to highlight here is you've got to be thinking about so many things as you think about that patient population, the findings from the study, and how it then gets um, applied to your patients in real time. So this week, your job is to read the article, review the discussion topic questions, and post and respond to peers.